Hello, junior doctors, MBBS students, and parents of MBBS students. So, this is Dr. Dhandapani, Nandakumar, a psychiatrist. So, in this video, I'm going to talk about what difficulties the MBBS students go through during their MBBS course and the internship. Because it has been like a taboo that doctors will not have any mental health issues, but that is a myth. Every doctor goes through a lot of struggles during their undergraduate and postgraduate training. So it is very important to understand what are the difficulties gone through by the MBBS students at first, and then what are the things which is waiting for them in line before they get into a practice. So everybody in the family is very happy when one of their kids get into medicine, but even though the happiness is enormous, the same thing will not be persisting for a very long time because MBBS is a career where the earning comes late, but the hard work takes away your entire second and third decade. So, because of the academic pressure and the financial problems and the family pressure, most of the MBBS students undergo so much of stress. Sometimes I even see students resorting to suicide because they could not handle the pressure during their MBBS days. So we will see what are the stresses each MBBS students will go through during their training period and how to handle them. At last, we will be covering what parents of MBBS students should be doing to help the children to go through this stress. So MBBS is a 5.5 year course where 4.5 is for academic program and 1 year of internship. So first year will be like a Goliath and David fight, where the first year itself is so vast and difficult to process, but we feel sometimes helpless. Even though there are only three subjects anatomy, physiology, and biochemistry, people underestimate how many books we have to read for each subject. So, if you take anatomy, there is the main anatomy, and then there is osteology, there is histology, there is embryology, and other stuffs. And similarly for physiology and the biochemistry, there are subdivisions. So for the first year to read so many books during a shorter time period becomes difficult. So there is always an academic overload. And the second thing is they have just graduated from their 12th. The way we learn in our 12th grades is different from how we learn in medical colleges. And there is no concept of mugging and memorizing in medical college. It is mostly of understanding. So, but the first year students usually tend to fail at this, and they see getting low marks as an insult. But particularly the first generation doctors who just come, who have secured like 90 marks, 95 marks in their school, all of a sudden they come here and find themselves getting fail marks, not even like 20%. So, this is very common. Medical syllabus is not your 12th standard. So, definitely, people who are having difficulties, it is completely normal. Whoever has crossed this phase will tell you, yes, they have also gone through the phase and how to read the first year syllabus. Second is the communication difficulties. Suppose if you are from another state and getting to the All India quota, you might be finding it difficult with the language of the locals, and you might be finding it difficult to communicate, and there are a lot of cultural things which the students used to talk. So in the first year itself, the friend formation is based on the regions they come from, the taste they share. So if you are from other places, you might find it difficult to find friends. So this is a bigger problem for children who just finished their 12th standard. So third thing is the adjustment to hostel life. Most of the children have been raised by the parents at home with all the comforts where they don't have to take care of the household chores. But once they come to hostel, they find it difficult to handle the situation. Right from washing clothes to taking care of themselves, having a meal, or they might not like the taste of the food of the hostel, or sometimes the basic facilities may be missing. So they find it very difficult to adjust from the home environment to the hostel environment. Next is peer competition and comparison. So since MBBS is taken by the students who are bright, there is always a tough fight between the students. It is like taking all the top minds and putting them together, and they find it difficult because they have been getting first rank, second rank all through their schoolings. and all of a sudden they come to college and they find themselves failing, getting the lowest mark or the last rank. It might be disheartening to the kids, and I will be telling to the MBBS student that it is completely fine. During your MBBS days, there is no first rank, second rank, and everybody is trained to become a good doctor. So this is the first grueling step, and not necessarily you need to compare yourself with your peers, and try to be better than your previous self. That should be the motto. Next is the emotional problem which the MBBS students go through during the first year. Since they have been along with their parents, there is a source of support to vent out what they are feeling, and it becomes hampered during their first year because they have been struggling so much. But everything talk happens over phone, so they might not have the physical presence of their parents to share things, so they might find it very difficult. Next is lack of sleep. So I could see some students who are sleeping just for 3 to 4 hours during their first year because they got low marks. So this often leads to burnout. So they're trying hard to study without knowing the clear technique of what to study and how to study and how to make notes. So this would lead to poor mental health. And the lack of sleep is always a main reason for burnout and stress and depression in most of the medical graduates. Next is the sedentary lifestyle. Because they are always occupied with the academic topics, they find themselves they have no time for relaxation, and they usually sit down and study. So they lack physical activity. They go to class and then sit down, they come home and then they read. So most of the time is not spent actively, so they kind of get obese. One is because of the stress and the stress eating. Second is because of the sedentary lifestyle which they develop after joining the college. Then the difficulties faced in each laboratory. Sometimes in anatomy lab, they will have to face the cadaver and they will have to operate on the cadaver. And in physiology lab, they will have to prick themselves, which might be difficult. And in biochemistry lab again, the same mixing of chemicals, the understanding of those could be difficult. So next is the financial struggle which they are going through. So sometimes it is better that some people get into government colleges, but few others get into private colleges. So they have the guilt feeling that I have made my parents struggle so much by joining MBBS course where I'll have to pay X number of lakhs and I am a liability to them, I'll have to answer to them. So they carry this guilt for a long time, and this adds to their pressure. Apart from that academic thing, they find it very difficult to cope because of this financial stress. Next is the family expectation. As the parents make their children join the medical college, they expect them to score well. They wanted them to study daily and they wanted to upgrade. But they usually are first generation doctors. So none of the family members have been in the medical field for a longer time. So it is very unnatural for them to have the knowledge of how MBBS degree goes. So whenever their kids get low marks, they feel very frustrated, and sometimes they blame the kid like you have changed a lot after joining the college. So but it is very normal for a kid to undergo these pressure, and sometimes it is okay to fail during the first year MBBS, so it is not something very abnormal. At least 80% of the students fail during the first year MBBS. Next is the problem of first generation doctors. So whoever has joined or is the first generation who entered into the medical college always faces this because they feel always inadequate. The inspirations they take are actually very high and they have a long path to travel to reach their heights. So this puts them in a state of worry whether I will be able to achieve those big feats. Even among the second generation or third generation doctor, there is always pressure on the kid that whether I will be able to fill my grandfather's shoes or whether I will be able to manage the hospital my parents own. So these are the common stresses which the first year students usually face. So the following are the solutions which everybody can use to easily mitigate to the first year. So first is orientation towards the course. You know what are the subjects to learn. You should know what are the subjects and what are the books to read, and then you need to prepare a plan so that you will be able to read everything and revise everything before the exams. So in this process comes the mentoring. So whoever you are able to find a friendly senior, you will have to get hold of them and know what to study and how to make notes. So this will help you avoid wasting of time just trying to figure out which method will work. And you can reach out to the faculties if you are finding it difficult to find a senior. Next, it is also very important to understand how to manage your stress. So there is financial pressure for the kid, there is academic pressure for the kid, there is difficulties in the hostel, there is peer relationship difficulties, then there is comparison with the peers, and then comparison with the relatives. So a lot of things are going on around the child's mind. So how to handle each of them? So identify what is the stress, what are the things you can focus on, and what are the things which is out of your control. For example, if you are finding it difficult to study, then you are just struggling to find out what are the techniques to study. So that should be your focus. There are a few things which is out of your control, your parents' expectation or the relatives' expectation. Those things are out of your control. So you should be trying to avoid those things. So it is always better that you always have a 45 minutes of physical exercise and then 20 minutes of a breathing exercise or progressive muscle relaxation exercise, which is easily available in the internet, which you can do. Next is the peer support. So always friends form an important life of MBBS career. I have hardly seen people who easily cross through the reverse tough tides of MBBS without having the friends help. So it is always very essential to read in groups and see how other people are understanding and how is your understanding. Sometimes a friend who is explaining a topic might be very easier, and that's how most of the people have understood some topics. So always we have the open door so that you can go and teach somebody and you can listen to somebody who is able to teach. And if you're able to make a group plan, then it works well. Maintain a healthy lifestyle during your MBBS. Sedentary life and lack of sleep is not going to help you. So 45 minutes of activity is very essential again. 8 hours of sleep is very essential. And the rest of the things you can plan according to the time. So you need to have time on a weekly basis for fun activities, which could be going out, which could be eating outside, or any other things like that. Then there is crisis help. So people who are finding it difficult to handle the stress should be reporting to the faculty, or faculty should identify them and help them to go through these stresses. So at least the academic stress should be made easy for the kid. So if you are a student and if one of your batchmate is going through so much of difficult time, it is also essential for you to bring to the notice of the teachers that he is going through so many things, and have an open place where everybody can share their difficulties. Maybe a reflective session where everybody, like having a small group of 10-15 people sitting together and say how their week went, what are the difficulties they faced, and how did each one of them handle those situations. So those things could be discussed on a common forum. So second year is the year of transition, where from anat, physio and biochemistry you move towards pharmacology, pathology and microbiology. Each is a vast subject and each deals with systems in detail. But the problem is, it is more of volatile content, and you will be reading about the clinical condition without actually seeing the patients, or you will be seeing the patients and usually it is not related to. So people find very difficult to handle the voluminous subjects and volatile nature of the subjects. This is the first problem. Second is the lab work. They will be asked to see the slides and identify those slides. So people are usually, what they see in book is not actually reflected in the practical thing. So that reality strikes it. So whatever you read in book may not be the actual picture we will be seeing. So it might have little differences. So people find it difficult. Somewhere we will have to find the X in microbiology. In pathology we will have to identify the slides which they are giving of different health conditions. So it becomes difficult for the MBBS students who have read the book, but now they are actually focusing on the clinical side. The next is people start forming groups during the second year. Some share the common interest, so they become close. Some might not share, though they feel left out. So it is also very common to feel left out during your second year. Let's see how we can handle these problems during the second year. First, to handle the vast majority of the subject, so you by now know how the medical education works. So you need to start making notes and seek the help of seniors first thing. With relationship to the friends, it is always essential to find friends who have common interests. So if you are a studious person, it is better to stay with the studious people. And then if you are a physical active person and involved in sports, so always find friends of those sorts. Then is the third year. Third year is usually considered as the honeymoon phase of MBBS because there is a lot of spare time, and this is the time where people start preparing and taking decisions about their career, whether they want to stay in India, whether they want to pursue further studies abroad, and where are they going to plan. So this is the phase where people try to excel in sports, people try to form relationships, people try to focus on their career and shape themselves. So usually stress during this period is handled much better. Again, during the final year, there are four subjects: medicine, surgery, OG, pediatrics. Even though it is mentioned as a single subjects, there are sub branches and shorter subjects which is associated with each. So here also people find it difficult because this is the final year and they'll be spending a lot of time studying. They'll have to see the patients, they'll have to work up and other things. So they find it difficult, and people will be divided into smaller batches. So from a batch of 100 or 150 or 250, they'll be reduced to 5, 6 or hardly 10 people. They'll have to find themselves the solutions for the problems they face, and they'll have to present cases very regularly. Next is usually the positions which is held in the student council is by the final year. So if they are involved in that, they also have to manage those things. And when a junior comes and seeks help, they'll have to be knowledgeable and have supremacy in academics. So this again puts a pressure on the final year students. The solutions could be: plan your academics well in advance. So what are you going to learn? When are you going to learn? How are you going to learn? Second, always seek help of people who have passed out. Third, even in small batches, try to do things even when nobody is noticing. And try to achieve your clinical experiences which is expected out of you. And spend equal time on academics, sports, and administrative positions if at all you have. If you find it very difficult to manage administration post, try to resign from them. And whenever a student or a junior comes for help, try to help them in the possible way. Whenever you feel difficult to handle them, just kindly refer it to a friend who would be of good help. As far as MBBS is concerned, it is not only the students who are stressful, even the parents are extremely stressful for a few reasons. One is the financial strain. Every parent goes through so much of difficult paying the fees for their children if they are in the private colleges. Usually parents would have spent their life savings on their kids' education. So they might be little strained or stressed because of this financial problem. Second thing, long duration and delayed independence. Students joining the engineering courses and other art courses start earning by the age of 22 or 23. But for MBBS doctor to make a decent living, it takes 27 to 30 years. So it is the difficulty for the parent to sustain their kids for that long, even though they had so much of enthusiasm while joining the medical courses, but making them go through these tough times and seeing their kids suffer so much, but they're not making the ends meet by the end of 25 or 26 may frustrate the parents. And sometimes the parent feel their children are not performing well, they are getting failed marks. So which may put again so much of pressure that their money is getting wasted, the child is not using the opportunity to become a good doctor. And the concerns always persist with the parent. As the children get busy into the academic courses, they might find less interactive, they might not talk to on a regular basis, they might not be able to share, they might not be able to call you. So again, which increases the distance between the parent and the kid. Sometimes the parents are not able to understand what the kid is going through, and the kid is not able to express to the parent what they are going through. Apart from all these things, they might also have to face relatives pressure, peer pressure. One of the uncles working in office could ask, like, what is your son doing, how is he earning or not? And one of the relatives whose son has taken other branches, what they are doing. But when they tell, like, my son is pursuing MBBS or doing this, that, oh, my son started earning and your son is still in MBBS. So this could be a bigger comparison, and which might again put the parents down whether the decision which we have taken is right or not. The solutions for problems could be: plan your finances in advance, how you are going to pay the fees without any difficulty, and what is the risk you are taking. And second, you cannot meet expectation of the society. So you will have to handle the societal pressure rather than displacing it towards your children. Third, the communication gap is actually true and real. You should be always open to listening to your children's problem, because if you don't provide that emotional support, these are the situations where your kid might do something wrong. It is also important for the parent to understand medicine is a long career. They're not going to earn before 26 or 27, and even if they earn, it is going to be little. And practicing and things are going to take time. Even the great people you see would have established themselves after 40 or 45. You need to have patience. Academic expectation and the fear of failure of their children is very true in parents. So, if at all they go through that, they will have to handle those things with confidence and have confidence in the children. Suppose if you feel your children is falling out, try to communicate with the children and the faculties of the medical college so that you'll get some help and have understanding. MBBS might not be a rosy journey for the kids as well as the parents, but for a great doctor to be made, people have to be grinded, ironed out, and then before the final product is ready. If you're a student, all the best. If you're a parent, try to be patient and support your child in all aspects of life.